Once every 6 hours, someone in Michigan takes their own life. This is an avoidable tragedy. Clinicians in Michigan are at the forefront of saving lives, and their approach to suicide prevention is evolving. Thanks to My Mind, an initiative led by Henry Ford Health in partnership with Blue Cross Blue Shield of Michigan, medical professionals are changing the way they think about, diagnose, and treat individuals at risk for suicide.
More than 90% of people who attempt suicide have a healthcare visit in the weeks and months before they attempt suicide. And so we have an opportunity with them right in front of us to make a difference. Why My Mind is so powerful is that it's a collaborative initiative. People might go to a lot of places for care, but we're working together and we're working across systems to help prevent suicide.
My Mind is an initiative that revolutionizes how primary care and behavioral health clinicians approach mental health care, equipping them with the knowledge and techniques needed to effectively intervene and prevent suicide. By promoting a comprehensive, collaborative, and compassionate framework, My Mind is empowering healthcare professionals to recognize, address, and prevent suicide more effectively.
Since we established My Mind in 2022, I think we've come an incredibly long way. We've seen the development of creating new curriculum that really teaches people about how to use evidence-based suicide prevention protocols that they can tailor to their clinics. But in addition to that, we're starting to learn from our providers themselves and what they've found to be best practices. So I think that, for me, has been something that has been tremendously impactful.
Through specialized training resources, My Mind has changed the way clinicians assess suicidal ideation and introduce treatment to modify risk. My Mind makes assessing mental health a shared responsibility between primary care and behavioral health. By integrating mental health screening into every patient interaction, we are connecting body and mind for better health.
Bridging the gap between primary care and psychiatry is an important, essential component of My Mind and essential for suicide prevention. Our project has 3 elements. The first is, how do we train every mental health professional to understand the risk for suicide, modify those risks to save lives? The second important piece is, how do we bring primary care doctors and nurses into that conversation to help us screen for suicide risk? The third prong is, once a primary care provider identifies risk, the idea of My Mind isn't to put this all on the backs of a primary care doc, but to be good partners so that behavioral health in various forms can come and help further assess and treat that individual.
Whether a patient is visiting for a routine checkup or seeking specialized treatment, mental health is always part of the conversation. This proactive approach ensures that patients at risk for suicide are identified early and an appropriate level of care is assigned.
My Mind has an incredible opportunity to fill the gap between behavioral health and primary care, and that many more people will be seen by primary care physicians than they will by mental health professionals. I really appreciate the opportunity to work with other providers in this collaborative nature and learning about what works and what doesn't work in other clinics.
My Mind is taking to the next level what we have always wanted to do, which is to have knowledge in a easily understandable fashion available to the provider, the patient, and the family at the time that they're being seen.
What we dread the most is suicide. So having these tools, these strategies where primary care doctors feel comfortable asking about suicide and knowing what to do using screening, assessment, and intervention, it's a great idea. It's a great collaboration.
Zero suicide is possible, and that all of us, have that responsibility in prevention. You don't need to be a therapist in order to do this. That anyone in the healthcare field, people in the community are able to be part of this important initiative because we all can prevent suicide.
Through comprehensive training programs, My Mind equips clinicians with the tools and resources to recognize the warning signs of suicide and mental health crises. My Mind also helps foster collaboration between medical specialties, encouraging a team-based approach at the practice level that ensures no patient falls through the cracks.
The curriculum that we have built for our trainings and our coaching calls is really built on 2+ decades of evidence-based research related to suicide prevention. For so long, we thought that this suicide prevention, this mental health parity, is really just for behavioral health and siloed into that. But we now know that we need to involve all the departments within the healthcare system and really work on a systematic level to support suicide prevention. And I think that My Mind is working on that and is a driving force for that in Michigan.
With My Mind, clinicians are empowered to take action. By removing the stigma of talking about suicide, healthcare professionals are no longer just treating symptoms. They're connecting with patients and saving lives.
My Mind has helped us make sure our staff is educated and that we are all utilizing the same approaches to identify suicide risk with every patient, every time. The training and protocols have made our practices more consistent.
The interactions and feedback from the My Mind trainings have helped us feel more comfortable and confident in having conversations about suicide with our patients. We take what we learn in training and bring it back to our entire practice.
Patients come in for a physical health need, and along the way, we discover they also need mental health care. The My Mind protocols, such as the PHQ-9 and safety plans, offer a clear, evidence-based path for prevention and treatment.
My Mind's evidence-based approach is backed by 20 years of research and data provided by world-renowned scientists and experts at the My Mind Coordinating Center. Clinicians have access to the latest suicide prevention methodologies, rooted in clinical studies and real-world outcomes. This allows them to apply proven strategies, making suicide prevention not just a possibility, but a reality.
Data helps us to drive our initiatives. It helps inform our clinical decision-making. It's really powerful. And in My Mind, we're collecting data and harvesting it from all of our participants. And so that means that we have an opportunity to understand and improve over time the way that we deliver care.
By educating primary health physicians and further enlightening behavioral health specialists, we are changing the way clinicians think about suicide prevention and mental health. My Mind is shaping the future of healthcare through continuous evaluation and improvement. With a goal of 0, the program is driving systemic change, ensuring that suicide screening and assessment is an integral part of every patient's care journey. Through education and support, My Mind is building a foundation for lasting change.
All of our My Mind work is based on zero suicide guidelines. The fact that we feel a goal of no suicide deaths is achievable. But in healthcare, we often don't think of 0 as the goal. And so I think one of the exciting things is, number one, Henry Ford as a health system has gotten to 0 deaths from suicide. And we feel that that's something that providers throughout the state can achieve also.
My Mind is transforming clinical practice, but the work doesn't stop here. We must continue to train, collaborate, intervene, and innovate to ensure that every clinician is prepared to help patients at risk of suicide. Together, we can prevent suicide and build a future where mental health care is accessible, compassionate, and life-saving.